Hey everybody, it's Dr. Akiba Green here. Now, I've had the pleasure for several years in a row to speak at the Gluten-Free Expo. I happen to be one of the keynote speakers in 2013. Really, I want to talk for a couple minutes about some clinical reasons why not to eat wheat. The gluten-free industry is now reaching over $6 billion a year in sales. We're seeing a profound shift in the way people perceive the role of wheat in their diets. Whole wheat used to be celebrated as a powerhouse health food, but now people are increasingly rejecting wheat grains and seeing that it may be the very cause of their health problems. The mainstream media, other detractors, including many medical doctors and associations, claim that the gluten-free movement is just a fad, or worse, those who follow a gluten-free diet are actually making themselves worse. Others really claim that when you feel better after eliminating gluten out of your diet, it's not proof of anything actually improving. Well, we all know the traditional medical system wants to see biopsies, antibody testing, genetic tests show positive before they'll say that you have a problem with gluten. But in my practice, I see a fair percentage of patients who do not show positive on any of those tests, yet still have a documented issue with gluten sensitivity. The reality actually lies in the PubMed literature. This is the database that's established by the National Library of Medicine, which is considered the king of validity. The peer-reviewed medical literature contains over 21 million citation entries, which as of late 2012 contained 9,776, nearly 10,000 references to gluten as a problem in our bodies. Now, there's been a sharp increase in interest and research on the topic of gluten sensitivity. Author Saver G says we shouldn't be labeling it gluten sensitivity, we should actually be calling it gluten toxicity in order to shift the focus away from the victim, us, the person ingesting it, and back to the aggressor, which is gluten itself. In 1971, there were actually 71 studies listed on Medline which referenced gluten. In 2011, there were 514. Now, Saver has created an index list with hundreds of problem substances online that lists all sorts of abnormal health effects associated with these substances. If we talk about these issues, there's over 205 health conditions or adverse health effects that are associated with wheat consumption, all of which were determined solely through research in peer-reviewed and published medical journals indexed on Medline. So to really reiterate, where I'm going with this is all these different conditions that are affected when you eat wheat are documented in the medical literature in medical peer-reviewed research journals. This is not layman's, this is not somebody saying, oh, gluten's bad for you. This is what's published by researchers and medical doctors worldwide in our Bible of literature, what we use, the Medline. So I've also found that there are over 20 distinct ways in which wheat harms the body. And examples would be neurotoxic, nerve damaging. Talk about the link between gluten sensitivity or celiac disease and peripheral neuropathy or MS. How about immune damaging, immunoreactive? The link between thyroiditis, Hashimoto's, and gluten sensitivity. The link between rheumatoid or Sjogren's or scleroderma and gluten sensitivity, or psoriasis. How about inflammatory? Again, you eat certain foods and it creates leaky gut, which causes inflammation elsewhere in your body. There's 20 distinct ways in which wheat harms the body. Now, current conventional medicine only recognizes a few disorders likely to be caused by wheat consumption. Typically wheat allergy, and that would be an IgE immune-mediated response. We're talking an allergist does skin testing on you and you respond to wheat. How about celiac disease? And they identify that through the traditional tests. There's 3 blood tests that they use, very limited. They come back positive because they're so limited, then you most likely have celiac disease, but it's not confirmed until you do a biopsy. Dermatitis herpetiformis, this is like the skin version of celiac disease. So you get rashes and outbreaks on your skin because of gluten sensitivity or gluten reactions. And how about exercise-induced wheat anaphylaxis? So these conditions are really just the tip of the iceberg when it comes to interactions with gluten and the body. The biggest issue here is that there's a giant database that firmly establishes, again, in the medical literature, the likelihood that wheat sensitivity or wheat toxicity is a universal human species specific problem, occurs in different degrees, but it's mostly subclinical, which means that at least, in traditional screenings, it's not going to show up. If you look at conventional screenings and technologies, they're going to say it doesn't exist, but we know that the problems are there. We know patients are getting sicker and sicker and sicker every day when they have that reaction against wheat. Now, you have to understand, a key player in gluten sensitivity is something known as wheat lectin. It's known more technically as wheat germ agglutinin, or WGA. This can cause a broad range of adverse health effects, even while being undetected through conventional screenings. When you do a celiac screen, it looks at alpha-gliadin, tissue transglutaminase, and maybe deamidated or native gliadin as well. Those 3 markers. Wheat germ agglutinin is not part of the traditional test. In fact, Cyrix array number 3 is the only test I've identified, and therefore the only test that I use in my practice as a result that will specifically test for wheat germ agglutinin as well as 12 other gluten markers. In order to fully appreciate the extent of damage that wheat or gluten consumption can have on the body, including sprouted wheat, I'm not going to name brands, but we know there's a brand that has to go back to the Bible of breads that you can buy, usually it's in the frozen food section, that have sprouted grains. And people often think that they're very healthy breads. They still have wheat germ agglutinin, they still have wheat in them. So you have to recognize that even those healthy sprouted wheats, they create reactions to you. And the enormity of articles that have been published on a wide range of wheat-based diseases, we'll talk about a few of these. So if we talk about just a brief synopsis I pulled, celiac disease, 1,799 articles. Gluten sensitivity or intolerance, 716 articles. Thyroid disease, 212 articles. Autoimmune diseases, 136 articles. Schizophrenia, 111 articles. In fact, the DSM, which is the database of mental illnesses, the DSM-4 actually rates gluten sensitivity as a neurological condition. Psychiatrists recognize gluten sensitivity as impacting the brain. Food allergies, 203. Psoriasis, 82. Diabetes mellitus type 1, 70. Irritable bowel syndrome, 71. Sjogren's, 60. Cerebellar ataxia, 53. Dermatitis herpetiformis, 50. Multiple sclerosis, 50. And the list goes on and on. It's just a snapshot. I've seen references that show hundreds of additional topics which gluten relates to. I have 14 articles directly confirming gluten sensitivity to Hashimoto's thyroiditis on my desk sitting as we speak. An article tying T4 function to gluten consumption, irregardless of sensitivity, shows a 40% increase in T4. That's that thyroid hormone that our body produces when you cut out gluten, which really means that if you're hypothyroid or you have low thyroid function, you may be on a Synthroid, Levoxyl, levothyroxine, and T4 support. If you cut gluten out, you very well may be able to reduce or eliminate your thyroid hormone prescriptions. I can tell you, I've worked with patients and their doctors. We've seen people who are on 50 micrograms, 30 micrograms, 25 micrograms of T4. Cut out gluten, can come off their medications because it was such a low dose to begin with, their thyroid functions normally again. This celiac iceberg simply illustrates the problems and issues associated with diagnosis and disease prevalence. More importantly, it represents a need for a major paradigm shift in how big medicine views both celiac disease and wheat consumption in non-celiac disease populations. Now, my office specializes in the accurate diagnosis and understanding of the full spectrum of gluten immune reactions, from celiac disease to gluten sensitivity and intolerance. If you're interested in learning more, I first advise you to visit my blog, www.drakibagreenblog.com, D-R-A-K-I-B-A, greenblog.com. Enjoy the reading. I've got a ton of great resources that are on there for you. More importantly, I encourage you to call and schedule either an in-office consultation or a distance medicine consult with me to see if we can help you with your health problems, whether it relates to gluten sensitivity, celiac disease, one of the other 26 food markers we test for, or other chronic metabolic health problems that medicine has not been able to help you with. My office number is 704-987-3993. My main website is drakibagreen.com. I look forward to meeting with you soon. Thank you.